Noon. This is the third meeting of the House Standing Committee on Health and Family Services, and I just want to welcome everyone. I guess we'll just take the roll now. We don't have, yeah, okay. Secretary, please take the roll.
Representative Bentley,
Here, in the room.
Representative Bowling, Representative Bray,
In the room.
Representative Birch, Representative Dotson,
Here.
Representative Elliott, Representative Fleming,
Present.
Representative Frazier, Representative Marzian, Representative Prunty,
Here.
Representative Rayburn,
Here.
Representative Raymond,
I'm here from home.
Representative Riley, Representative Sharp, Representative Sheldon, Representative Tate, Representative Weber,
Present in the room.
Representative Westrom, Representative Wilner,
Here in the annex.
Chairwoman Mosier.
I am here. All right, we have a quorum established to do business, so I will just go ahead. Since we are-
Representative Bowling's here.
Oh, thank
Thank
you,
you.
Representative Bowling. And Representative Tate. Thank you. Okay. We are limited to an hour, so we will go ahead and get started. If you can, this is House Bill 95, which we will be discussing now. Representative Bentley is the sponsor. If you can just introduce your guest, or you can introduce yourselves, and please proceed.
Thank you, Madam Chair Lady. My name is Danny R. Bentley. I'm representative for District 98, Greenup County, and part of Boyd County. And the co-sponsor, I'll let her introduce herself.
I'm Representative Patty Mentor. I represent Bowling Green's House District 20, and I am a proud mother of a son who lives with type 1 diabetes, and proud to work with this gentleman on this important legislation.
Thank you. Would you like to adopt the committee sub first?
Yes, ma'am.
Is
It
there
has a
motion
committee-
to adopt? Second. We have a motion and a second. All in favor? Aye. Any opposed? All right, thank you.
Thank you, ma'am. Last year, we presented this bill with a $100 deductible, and there was no objection on the floor. It passed by 92 to 0. It did make it out of the Senate, but it is a concern because the price of insulin is so high. This is a pen.
Motion on the bill.
I have a question. Could you explain why the amount was changed from 100 to 30?
Yes. Insulin was a class issue in Washington, D.C., and Medicare lowered on Medicare Part D to $35. So we tried to stay in line with that. And it's better for our Commonwealth. I was going to say, this is worth about $60. For me to buy my insulin a year is about $12,000. So, good point. Thank you for your question.
This is just a reminder for anyone who is not on campus. We will not be able to accept your vote if you are remote today. And I apologize for that. That's just the House rules that we adopted. Okay, seeing no further comments or questions, please take the roll.
Madam Chair, there's someone on Zoom, I think, that needs to speak about a minute before maybe taking the vote.
It's up to you.
Her name is Angela Lautner from Insulin for All.
Okay.
Let's give her a minute, and if you would,
that's-
give the co-sponsor 1 minute.
I'm happy to do that. We just have a motion and a second.
Okay,
So
I'm sorry.
Yeah. Just don't talk yourself out of it.
Yeah, all right. I've done that before.
Yeah, don't do that.
All right. Mrs. Lautner, if you would like to proceed, thank you.
Hello, everyone. Thank you, Chairwoman Mosier, for this. I am not really going to take up any more time. I just want to remind everyone this vial of insulin, it doesn't cost any more than $6.16 to make. The copay cap here for $30, which will apply to state employees and people who purchase their plans on the Marketplace Exchange. Puts a copay cap limit at $30. So just always remember this vial does not cost any more than $6 to make. And we would appreciate a unanimous yes vote today.
Thank you very much.
And I can add very little to that. This is, except to say, for those of you who were part of this body last year, this is a better bill than the one that this body passed 92-0 last year. And then it disappeared on right before Sine Die. I hope it's going to go all the way this year. The cap is lower. It is also, we learned from our constituents that we needed to expand this to apply to people in the state plan. So this bill will cover more people than it did last year. The copay is better. We still have a lot of work to do to get to the point where, as Angela correctly points out, it costs $6 to make that vial. The last time my son filled a prescription for a 30-day supply, it was over $150. So on behalf of everyone in Kentucky who lives with diabetes type 1 and type 2, I thank you so much for your support this morning. Hope we'll get a unanimous vote and the same on the floor. Thank you.
Representative Minter, just for the record, if you could please identify yourself.
Yes, I'm Representative Patty Minter. I represent Bowling Green's House District 20, and I am the primary co-sponsor of this bill and the mother of a child who has lived with type 1 diabetes since he was 19 months old.
Thank you very much. Thank you for being here. Representative Westrom, do you have a question?
Yes, ma'am. This is just a quick question. Representative, we saw the same thing happen with EpiPens, and I think this is so sinful. When you take advantage of people who desperately need a drug and just nail them to the wall with prices. Has that been remedied at all? I haven't heard anything lately on that.
You mean on the EpiPen?
The EpiPen, it went up over $400.
The generics are a little cheaper right now.
A little as in
Yeah.
just $200?
Yeah, they're somewhere in the 200 range.
Oh, my
yeah,
gosh. Thank you.
Yeah.
All right. Thank you, Representative Westrom. I would just like to add that I have had a very positive meeting with the Personnel Cabinet who had some concerns, and you addressed those, and they are very grateful. So thank you.
Yes, ma'am.
All right. See no further questions. Please take the roll.
Representative Bentley?
Yes.
Representative Bowling? Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier? Representative Marzian? Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond? Representative Riley?
I'd like to quickly explain my vote as a parent of a son who has extensive medical payments and medical bills. I'd like to, that have nothing to do with diabetes. I'd like to thank Representative Bentley and Representative Minter for their work on this bill, and I vote yes.
Representative Sharp? Representative Sheldon?
Yes, explain my vote real quickly. I've dispensed this medication for almost 40 years. Dr. Bentley will remember when it was about $7 a vial. And this is a huge step in the right direction. I thank you both. Thank you.
Representative Tate? Representative Weber?
Yes.
Representative Westrom?
Yes.
Representative Wilner?
I'm happy to make it unanimous. Yes.
Chairwoman Mosier?
Yes. Thank you. House Bill 95, as amended by Committee Sub 2, passes with unanimous support.
I'd like to record a yes vote. Representative Bowling.
Thank you, Representative. Okay, so
Thank you, Patty. And when it comes to the floor.
again, House Bill 95, as amended by House Committee Sub 2, passes with favorable expression. Same should pass on the House floor. Thank you. And I know Representative Bentley, you are staying put to present House Bill 219. If there's anyone who needs to join you at the table, please do so now. And please proceed.
Again, I'll introduce myself. I'm Representative Danny R. Bentley, District 98, Greenup County and part of Boyd County. And to my right is my co-sponsor.
Steve Sheldon, representative from District 17, and appreciate being here.
Most of you don't know, but when you work retail pharmacy like Steve and I have, when a person comes in to get syringes, we have this black book that we pull out and we ask for their name and address, and we sign off on it that we give these syringes. Well, over the years, those things become pretty dusty. They aren't current with what's going on. But the one thing on there you would have to put was what they were using it for. Of course, you know that everybody wasn't going to say, I'm addicted to heroin and I need the syringes. So it was a stigma, too, because now with the needle exchange programs, and we're doing so well with that, and people are exchanging a dirty one for a clean one, this gives us a chance as retail pharmacists and also probably retail livestock places like, give me a gun.
Farm supply.
Yeah, farm supply. They sell syringes also, but they have to go under the regulations. So it's an update, and it's a good thing because we don't stigmatize those people, and we can get more information to them when we do this. So the Board of Pharmacy came to me to update this language, and so what it does, it deletes the retail record-keeping requirements for the sale of hypodermic needles.
Representative Bentley, before you go any further, are you speaking to the committee sub, and would you like to adopt the committee sub?
Yes, ma'am.
All right.
Motion sub, second.
All in favor?
Aye.
Any opposed? All right, we also have a House committee amendment to
The sub.
the sub. So we need a motion, second. All in favor? Any opposed? All right. Now you may proceed and speak on the committee sub.
Thank you, Madam Chair Lady.
Thank you.
It deletes the retail pharmacy record-keeping requirements for the sale of hypodermic needles. It adds two provisions for the sale of hypodermic needles for individuals without a prescription. They are a limit of 30 needles per person, and the individual must have a valid identification proving they are 16 years or older. If the needles are being dispensed for use in conjunction with a prescription, so you had to put sterile water into something to mix it, then the needles for reconstitution or administration do not apply. So this establishes a physical or electronic information on the safe sale and proper use. Also as a physical and electronic education referral information on substance abuse and treatment, and a verbal, physical, or electronic offer to provide naloxone, which is Narcan, for opioid overdose, and also a verbal, physical, electronic offer to provide the purchaser's name and contact information to a local public health substance use disorder outreach. Provides that the seller may be inspected during business hours by any law enforcement officer or an agent or employee of CHFS or the Board of Pharmacy who is engaged in enforcement of these provisions. And then we have the sub. The committee sub removes the sale limits on syringes to 30 per person, and it removes the proof of age. After we looked at it, we figured it kind of was too stigmatizing, and 30 was too limited. And if you just think about it, you would understand why. I'll let Steve speak on that in a second. But let me also talk about the amendment to the sub. The committee sub adds a new section, Section 3 of KRS 315 relating to the practice of remote pharmacy. And Section 3 permits a pharmacist to electronically access the electronic database of the pharmacy from inside or outside the pharmacy to perform order entry verification, or drug regimen review. Section 3 applies conditions to this practice, including confidentiality and integrity protection, prohibiting of the duplication of information, and applicable only to the non-retail settings, and prohibits dispensing from outside a pharmacy. This was put in because of the COVID crisis, and we have people that were needing this to keep jobs in Kentucky, and that's basically what it is. Steve, you have any comments?
Representative Bentley did a great job taking care of that. The additional language that we added concerning pharmacy remote work was really narrowed down, tailored down to just 3 types of data entry they can do. We've really nailed down that no dispensing can happen off-site. We've really taken care of any concerns that that we feel could be unintended consequences. We'd be open to any floor amendments if somebody at some point wants to bring something else up. But I think Dr. Bentley's done a good job getting this thing wrapped up. So I support it fully.
Motion on the bill.
Okay, we have a motion and a second. We have a question from Representative Weber. Okay.
Actually, more of a comment, Madam Chair. I want to thank Representative Bentley, Representative Sheldon for your work on this, especially the addition here of this amendment for the remote work done with the pharmacies. This directly affects my constituents in my district. I have a large employer in my district that has been doing this and will allow them to continue to do it. And then there's another facility on Fern Valley Road in Louisville that probably has close to 100 of my constituents who work there who would benefit from this. And I think this will allow for the recruitment of new businesses coming into the state with this opportunity to exist. So I want to thank you for bringing that forward and agreeing to allow your bill to be amended so that we could truly help the folks in this state. So I appreciate it, and thank you, gentlemen.
Thank you.
Thank you. Representative Tate?
Again, I'd like to thank you both for bringing this before us. You know, many other states allow this type of flexibility, and enacting this language into statute obviously gives us the flexibility, and businesses the flexibility for planning and investment, trying to make sure that Kentucky remains a leader in attracting more of these high-paid pharmacists and pharmacy technician jobs. So I absolutely applaud you for doing that. The only thing that I want to express concern about is that, and I've expressed concern about this, whenever we talk about remote work, I totally agree with that. You know, I always say that if we can outsource to India, we can outsource to Eastern Kentucky. So the only thing that my concern is that outsource word is that I do not want there to be any flexibility in this statute that would allow for the outsourcing to occur to other countries.
That's a valid concern, and actually we rolled in an amendment to that sub that actually said whoever we're outsourcing this to has to be licensed in Kentucky, the tech or the pharmacist. So we're making sure that those employees stay right here. Representative Weber indicated several. There's at least a couple thousand employees that are affected by this, and I agree with both of you. I believe other operations such as these closed-door operations that deal with rebates from manufacturers, and they're processing these things all the time. They're doing a great service for our consumers and and people for their health. Plus, they're doing it right here in Kentucky. Right. I think those type of operations will like this, and I think they'll look at Kentucky for more of an opportunity to come here.
Exactly, with high-paying jobs. So thank you very much.
Yeah.
Thank you.
Yeah.
Thank you. Representative Prunty?
Yes, my question, when you mentioned what was in it, you said something about to let the person know about potential treatment. I don't see this in the committee sub. Did you take it out, or is it somewhere else? Did I miss it?
it doesn't get as detailed as what he actually said, but it does say verbal, physical, electronic offer to provide naloxone, which is.
I saw that. I just didn't see. I thought you'd said that there was a potential information about treatment, and I didn't see it in. Wait a minute, there it is. I see it. B.
Yeah.
It's under B.
Yeah,
Never mind,
under
I missed it.
B and
I
C
missed
there.
it. Thank you. I was listening.
I put that back in myself. I think it was worthwhile.
Thank you. Of course. Representative Fleming.
Thank you, Madam Chair. I want to express deep appreciation for the chair as well as Representative that are presenting this bill. I work with them on trying to get some clarification, and Representative Bentley always harasses me about being a numbers guy, and I harass him for being a pharmacist guy, but I totally respect where he's coming from. He always puts forth very thoughtful bills. I just want to put some numbers. Representative Bentley, Representative Weber mentioned about his constituents in Jefferson County. There's around 2,000 or more individuals that work in Jefferson County. And when you look at that and go through some calculations, you're looking at, if this wasn't in there, you're looking at around $13 to $15 million that could potentially leave the state. And I know that's not the intent because we need to keep the jobs here and so forth. So in doing that, I do appreciate both of y'all working with me and others in making this happen. And I also want to point out Representative Tate in terms of outsourcing. When I was chairman of our mapping association, we came across that quite a bit in terms of outsourcing to other countries. And so what we do to insourcing, as we might say, in Kentucky, that'd be great. But I do appreciate both of y'all working hard on this, and I appreciate your consideration in doing this. So thank you.
Thank you.
Okay. Thank you very much. I would just like to also applaud you for your work. And I know that this has been kind of a long week, late nights working on this amendment and making sure that the Kentucky Board of Pharmacy is included in the discussion, as well as all of the folks here who are very supportive of this language. So I know that we have some folks from the Board of Pharmacy here to either answer questions. I don't know if you wanted to make a quick comment.
I will. I'm Larry Hadley, Executive Director of the Board of Pharmacy. And thank you, Chair Moser, for allowing us to appear. We also have Dr. Jill Rhodes with us, who is President of the Board of Pharmacy, and she would like to make some comments.
Please introduce yourself and proceed. You may be muted.
Yeah, unmute, Jill. Top of the screen. At the top. Okay. At the bar, at the top of the screen, just press.
We can't hear you. Yeah, and we've checked on our end. My apologies for the technological glitch.
Testing.
There you go.
Yeah, you're good. You're good.
Okay. Thank you so much for your patience, first of all, and thank you for the time to speak today. Obviously, this is a very important bill for us at the Board of Pharmacy, HB 219, and thank you for hearing it, and thank you to the sponsors. Given that the syringe, there does not seem to be a lot of question about that. I won't go through that in detail, but honestly, like changes to 218A.500 in tandem with KRS 217.777 would really allow pharmacists to improve and participate in important harm reduction strategies that I think would serve our community and our state much better. And I think we have a lot of work that we can contribute to that's already ongoing. So thank you for supporting that. I also would like to address the proposed amendment that was added regarding 315.020 on remote order entry of prescriptions by pharmacy staff. Back in March of last year, the governor did make that initial executive order 2020-224. that allowed the Board of Pharmacy to invoke the Emergency Pharmacy Powers Regulation 201KR2:330. And it allowed the temporary relaxation of pharmacy practice. That includes this practice outlined for the proposal in HB 219. So we've been, that's been wonderful. It's been very helpful. We were asked as a Board of Pharmacy in May of 2020 to consider whether remote order entry should be allowed as a permanent practice change. And the board did issue an opinion on this and did not believe new action was needed to allow for a permanent practice change at that time, given that the Board of Pharmacy had the ability to invoke emergency pharmacy powers already in response to emergencies such as COVID, pandemic, and others. And so, making a statutory change that affects the specific pharmacy practice may be premature at this point. The Board of Pharmacy is actively working with other organizations, including the Kentucky Department of Public Health, to proactively evaluate and make thoughtful and safe professional pharmacy practice changes based on both the pandemic impact and the appropriate steps to best take care of patients in Kentucky. We are charged as a board to protect the public, and the practice change should be given a thorough vetting and have consideration and expertise from all stakeholders in the pharmacy practice at the Board of Pharmacy. There are some potential unintended consequences that place some limitations on pharmacy practice the way it's currently posed, and potentially safety concerns, limitations to access to care or steering of patients to particular entities. So given that the application has a widespread impact, I do feel that there may be some considerations that our agency could make. And I would ask that perhaps that later part of the bill be considered removed potentially or amended if possible, so that our Board of Pharmacy can evaluate that practice change as we currently are. Just last month in January, we had a meeting, and we do have an advisory council, and looking at proactive and permanent changes that may need to be made going forward are being evaluated. And so we would invite those topics and discussion at our board.
Okay, thank you very much. I appreciate your being here, and I appreciate your testimony. I don't think we have any further questions. Do we have a motion on the bill?
So move.
Second. We have a motion and a second. Again, I just appreciate your work, and I really appreciate the harm reduction language as well. I think we are solving a few problems with one stone. Okay. We will go ahead and take the roll, please.
Yes. Representative Bowling?
Yes.
Representative Bentley?
Yes.
Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier? Representative Marzian? Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond? Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes, and I would like to say, explain that yes. For the last week or so, this language has been in the hands of folks at the Board of Pharmacy, and we're more than in tune to listen to more. We made several changes as a result of that. We're real happy to see any more language changes, and they can do that in a floor amendment. So yes.
Representative Tate? Yes. Representative Weber?
Yes.
Representative Westrom?
Yes.
Representative Wilner?
Yes.
Chairwoman Mosier?
Yes.
Passes.
We have a title amendment which we need to adopt. Okay. First, we need to roll the amendment into the committee sub. We need a motion.
Motion to roll the amendment into the committee sub.
Thank you. We have a motion, a second. All in favor?
Aye.
Any opposed? Okay, thank you. Now we have the title amendment to adopt. We have a motion on the title amendment. Do we have a second? Thank you. All in favor?
Aye.
Any opposed? Okay, thank you very much. House Bill 219 as amended by House Committee Sub 3 and the title amendment passes favorably, and the same should pass on the House. Okay, since this is the Representative Bentley and Representative Sheldon show today, they will stay put at the table and discuss House Bill 222. Please introduce yourselves and proceed. Thank you.
Steve Sheldon, District 17, Representative Steve Sheldon, and beside me, I get to go first this time, looks like. So beside me is, go ahead, Doc.
Representative Danny R. Bentley, District 98. Thank you.
Okay, let's. This is really something we heard over the interim, but those that are familiar with Senate Bill 50, we went to a single PBM method to take care of our Medicaid claims here in the state of Kentucky. The good news is that is moving along just fine. I've been in contact with the cabinet. Things are looking up, and they're working hard. They've had a lot to go through, so they're fully behind that. This particular bill was an idea that came to us over the interim, and it basically just offers an oversight for the cabinet to put together or take procurement on a entity that would oversee the implementation of not only Senate Bill 50, but moving forward beyond that, and actually taking a look at all the claims that get processed for Medicaid and checking them for errors and just being an oversight entity. And we put a lot of language in here that would, and I've talked to the cabinet just even recently within the last week, and there were some concerns they had. We've made some changes for them, but this is meant to help the cabinet. It's meant to help any errors that are found, make the pharmacies whole if they're found to be underpaid, and if the taxpayer is found to be an issue with the PBM, this entity will catch it. So it's basically an oversight to the Medicaid claims that go on here in Kentucky, and there's a lot that I could get into the details here with, but I'll stop there and let Dr. Bentley add to that.
Do we have a committee sub that you'd like to adopt?
Sure do. Mm-hmm. Yes.
Okay.
Let's go ahead and do that.
We need a motion on the sub.
Motion on the sub.
Second. All in favor?
Aye.
Any opposed? All right. Thank you.
Sure.
Madam Chair, the committee sub, we after we read this several times, and if we had this entity doing this job, we realized that we had to monitor them too. So we have limited that duration to 2 years. And so if they would take the contract with the DMS, they may be renewed for periods up to 2 years. So the total compensation paid by the DMS to the contracted entity, we don't know who they are, during the initial 2-year contract is capped at 30%. And there's a good reason for that. That's 30% of the total savings generated by the contracted entity. You know how much money we do in Medicaid. So the contracted entity is prohibited from performing drug utilization reviews. Okay? That's our job as pharmacists. And it wouldn't be their entity. So a process for, and doctors and nurses and everybody else, all the professionals that do that, I don't want to leave anybody out. A process for resolving underpayments disputes has been established also. So the provisions of that substitute, this act will sunset and expire on January the 1st, 2024. So I think that makes it more responsible and unless reauthorized by another act of the General Assembly. So that puts it back in your hands. And I just like those kind of things. Steve, you have some more comment?
The cabinet had some concerns about having some time to get Senate Bill 50 underneath their feet and get it implemented. It made all the sense in the world to not really, to kind of test and make this almost a pilot for a couple of years, let it sunset out, not put them under the situation where they may get stuck in a situation that, because this is new. I mean, the whole country is watching this single PBM program. This Senate Bill 50 was new. This is brand new. Nobody else is doing this, so they're going to be under a microscope. We don't want to flood them with RFPs and procurements all at once. So I think the cabinet was really upbeat about this after they knew it wouldn't start till January 1. There's Senate Bill 50 should be implemented by 7 or 8 months by then. They'll be under their feet, and this company should come along as a partner to them and help them make sure that the single PBM is acting in good faith, and we suspect they will be, but we found out in the past sometimes that's not the case.
Okay. We have a question from, Representative Westrom.
Oh my gosh, we've got such a history with PBMs. and I think this was a very wise bill that we did last year, and I really look forward to hearing the outcomes of that. With the new independent entity, they are paid by the savings they create by being a watchdog.
Exactly.
That's pretty clever. So you'll be giving us updates on how much they are paid and how much the state has saved as well.
Yes, we've actually required that they provide a quarterly statement to the State Medicaid Advisory Council, which are our advisory council, right, here in the House, once a quarter to let us know. And again, we capped their ability to make no more than 30% of what they find. But yeah, it won't cost us a nickel. And then we also made sure that, because we have done studies in the past that were astronomically high of what the PBMs had overcharged.
Oh, yeah.
And you know, and it wasn't, we didn't feel like it was right for them to be able to keep everything they saved us. So we capped at 30%. They were 100% okay with that. They were okay. Wow. And then 2 years from now, we'll all take a look at this again and say, okay, how did it work?
So one more question. So have you found the entity that will do the contract at this point?
No, there'll be a procurement process, and there's at least 2 or 3 entities that can do this kind of work, if not more, and we don't know who that'll be.
Okay, so we're kind of a guiding light in the country.
That's right.
Yes,
That's
ma'am.
exactly right.
Well, thank you. I really look forward to the outcome studies.
Thank you.
Okay. Thank you so much for your presentation. Again, thank you so much for your work. I know that a lot of work went into this. I was happy to be part of those conversations. It's exciting to see what sort of savings we save, what we see generated by simply moving to a single PBM on a state level, but then also adding this additional oversight in partnership with the cabinet. This is really a support mechanism and a reporting mechanism to the legislature. I think it's a very smart proposal, so thank you for bringing it. Do we have any further questions? Representative Fleming.
Thank you, Madam Chair. Just curiosity, have y'all gone through and did any type of pro forma on estimating the savings?
We have a different opinion.
We, for several years, have if you haven't seen it yet, you ought to go look at the black box study and other types of studies we've done in previous administration, as well as this one has been very on the ball. I know Commissioner Lee had made a comment that she was excited about implementing this single PBM and that it was looking good so far. So that's all I can say right now, but I think there's some good things coming. But as far as what it could be, I hate to spit out numbers, but because the numbers are really big, and there's a reason we have a 30% cap on how much they can, how much they find. So the numbers are significant that we found prior to coming up with this single PBM thing. And then, by the way, there were some protests to the single PBM. There was all this lobbyists saying that this wasn't going to be approved by Medicare, Medicaid. All the protests are gone. All they were all dropped last week, and they were really just protests by the people that didn't get the bid for our PBM. It wasn't by Medicare, so it was all misconstrued. The good news is we got a green light. We're heading forward, and I think that number will be significant.
Wow, this is brilliant. I think this is a great testimony of y'all's ingenuity, insight, in getting this through. I did want to just add some advice, and I don't know where to add this, but make sure that we look at the procurement process and not do it solely on price. Mm-hmm. But price, we should look at price value or even a quality-based selection and then back into that price. And I've been on the receiving end of that. I've been beaten up by the Corps of Engineers, but they knew we provided quality price or quality service. So I encourage y'all to make sure that materializes and so forth, and that'll be very, very helpful. And we've gone through, and the chair knows that we've gone through a credentialing process for health providers. And now we got to re-engineer that because that didn't turn out as well as we thought. So thank you very much for your ingenuity and creativity. Thank you.
May I answer that question? Just one
Quickly.
second. On the spread, the first time the black box in Kentucky was, what, 124 million? And in Ohio, it was 324 million for 1 year. Thank you.
Brilliant.
Significant. Okay. Thank you so much. See no further questions. Secretary, please take the. We had a motion, but we don't have a second. Thank you. Representative Bray. Okay.
Representative Bentley?
Yes.
Representative Bowling?
Yes, thank you, gentlemen. Great work.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Without a doubt, yes.
Representative Frazier?
Yes.
Representative Marzian? Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond? Representative Riley? Representative Sharp?
Yes.
Representative Sheldon? Representative Tate? Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes.
Yeah.
Okay. House Bill 222 as amended by Committee Sub 2 passes with favorable expression. Same should do on the House. Congratulations and thank you for your work. Thank you. Before we move on to the next to the last two bills, which I will present, I would just like to point out that we do have a status report on the block grants having to do with child care and development funds, the community service block grant, social services block grant, and temporary assistance for needy families or TANF block grant. This is just for our information only. All of that information has been shared with the committee. We also need to consider 9 regs. All regs have been reviewed by our staff, myself, and were sent to all committee members. Do we have any questions about any of the regs? All right. We need a, okay. All right. So consider those regs reviewed and approved. Okay. I will hand over the gavel to my vice chair. Make my way. Thank you.
Madam Vice Chair, I'd like to record yes votes for House Bill 95 and also House Bill 219.
Thank you. Glad you can make it safely. Madam Chair, the floor is yours. Introduce yourself for the record and you may proceed.
Thank you, Madam Chair. And I appreciate the opportunity to present these bills to you. I am Representative Kim Mosier of the 64th District. And first, I would like to discuss House Bill 276. With me, I have a few guests. I have Jessica Estes from the Kentucky Board of Nursing, as well as Betsy Johnson with the Long-Term Care Association. And this bill simply this legislation simply allows for nurses' aides who were trained and worked as temporary COVID personal care attendants, or PCAs, under the governor's executive order to accommodate increased workloads and staffing shortages in long-term care facilities during the state of emergency. And this would allow them to apply their supervised hours, the hours that they worked during COVID, toward their state-registered nurses' aide certification and registration. It requires the Department for Medicaid Services to accept the employment of temporary COVID personal care attendants as having met the necessary training for the state registered nurse's aide if a minimum of 80 hours has been performed in their duties as PCAs. They are all supervised by licensed and or registered nurses, and those nurses are they are certified instructors. They must pass an assessment and a certification examination. And I would just invite Betsy and Jessica to add any comments at this time.
Thank you, Chairwoman Moser. This is Betsy Johnson, and I appreciate the opportunity to speak. First of all, I represent the Kentucky Association of Healthcare Facilities, and we represent over 275 long-term care providers across the Commonwealth of Kentucky. And we really applaud Chairwoman Moser for bringing this bill forward. Addressing workforce issues and long-term care is a priority for our association. It was a priority before COVID-19, and it remains a priority today. And House Bill 276 represents one solution to addressing workforce issues in long-term care. We applaud Representative Moser for always willing to listen and work with others to find solutions to complicated issues. We also want to thank Eric Friedlander, the Cabinet Secretary, and Adam Mather and Keith Knapp for working with us during the pandemic and also supporting this bill. They know that more staff in long-term care facilities means more quality overall. So again, we thank you, Representative Moser, for your leadership, and we urge the committee to support House Bill 276. Thank you.
Thank you.
So the only thing that I would offer to this, Representative Moser, is that we at the Board of Nursing have been responsible for the database management for both the nurse aides and the PCAs. So for us, the process will be very seamless in monitoring which of those PCAs has completed the training. The long-term care facilities report that information to us. Then they would test as a normal nurse aide would through the KCTCS system. And then that information would be transmitted to us to be put forth in that online format.
Can you introduce yourself for the record?
Oh, sorry about that,
That's
Representative
okay.
Prunty. I'm Jessica Estes, the Executive Director at the Board of Nursing.
Okay. Thank you. Thank you for your testimony. Any questions? Representative Westrom.
Thank you for the opportunity to ask this question. The first question I have is, what are the duties they fulfill as their job description, and what is their salary range?
I don't have the answer to your question in terms of salary, but nurses' aides provide personal care and assist nurses in their duties in caring for individuals. Nurses' aides are used in long-term care facilities, skilled nursing, hospitals. I mean, they really run the gamut of support staff, and they're wonderful people. They do a yeoman's level of work in just making sure that individuals get the personal care that they need. I would also add that this legislation really is one of those policies that encourages folks to continue their education. It's an entry-level nursing position, and these folks are able to get some really valuable experience and of course, personal gratification and just knowing that you're caring for people who really need your help. But I like this because it really is a step in creating kind of that pathway, that career pathway that we so desperately need in nursing homes and anywhere that nurses are that valuable piece of our workforce. So,
well, I know we've consistently had a shortage of healthcare staff, and it sounds to me like they really have become, because of COVID, a real safety net that our medical care suppliers have found themselves in. Thank you so much.
You're very welcome.
Seeing no other questions, do I have a motion on the bill? Motion on the bill in a second. Madam Secretary, take the roll.
Representative Bentley? Yes. Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott, Representative Fleming,
Yes.
Representative Frazier,
Yes.
Representative Marzian, Representative Prunty,
Yes.
Representative Rayburn,
Yes.
Representative Raymond, Representative Riley, Representative Sharp,
Yes.
Representative Sheldon, Representative Tate, Representative Weber,
Yes.
Representative Westrom, Representative Wilner,
Yes.
Chairwoman Mosier.
Yes.
House Bill 276 passes with favorable expression and should do so on the House floor. I just want to thank you, having worked in nursing homes. I know they've probably been very stressed during this COVID. It's very practical and common sense to empower people to move on to higher and better things. So thank you.
I agree.
Move
Thank you.
on.
And I just want to thank Jessica for looking this over and making sure that we are putting in place some really strong policies. So thank you. And thank you, Betsy, for all your work.
Yes.
Appreciate it.
Thank you for being here, ladies. And If
Okay.
you want to proceed with your next bill.
I would be delighted to. Again, I am
307.
Representative Kim Mosier for the record, and I am here to discuss House Bill 307 today. This bill is simply a cleanup of House Bill 333 from 2017, a bill that I passed where we used the word cannabidiol in reference to any FDA-approved fractured marijuana product, which was allowed because it is FDA-approved by prescription. At that point, it was only allowed in clinical trials, and if we had not changed that language at that point, the individuals who were in those clinical trials, specifically for Epidiolex, would have been kicked off. And so we used the word cannabidiol because it was specific to that class of medications. Since then, pharmaceuticals have evolved and improved, and since the passage of House Bill 333, both CBD and THC products called cannabinoids have been developed. And so with me, I have Mr. Bob Babbage, Rebecca Hartsoe, and Martin Smith, who is the president of the Hemp Farmers Association, with us, all to help me discuss the benefits of utilizing, really just changing the word cannabidiol to cannabinoid. We can allow, I think, Rebecca to discuss the medical benefits, and then perhaps Martin, you can discuss the benefits to our hemp farmers. Just please introduce yourself and proceed.
Motion on the bill.
Madam Chair, do you want to give their testimony since?
Well, I think just for
educational purposes,
a little public education, it's important to know why we're doing this. So if you don't mind, just a couple of minutes.
Yes, I would agree.
Okay, thank you. Rebecca?
Absolutely. Thank you, Chairwoman Mosier. This is wonderful to be able to present this bill. So I'm Rebecca Hartsoe, and contract lobbyist for GW Pharmaceuticals. But what's important here is that cannabinoids, just as when you passed 2017 to have this bill define it as cannabidiol, have been developed over time. And what they do is that they significantly reduce symptoms for people with neurological conditions like epilepsy, like multiple sclerosis. And so all of this hinges on FDA approval. That's what's really important here. Pending FDA approval, what this means is that whenever these drugs hit the market after they've been approved, that we don't lag any time for people who are suffering from spasticity and other horrendous conditions associated with neurological diseases. And so we're just making sure that everything is in place, that as soon as they're approved, that these people can get the sort of care and benefit from these pharmaceuticals that they so need in order that they can live a better quality of life. And Bob, you can also add to that as well.
Well, you're a landmark House Bill 333. 4 years ago, Representative Mosier, Chair Mosier, was a breakthrough to allow the quick movement of these really miracle drugs to get to people who need them so much. Epidiolex treats folks who had multiple seizures in a day and changed their lifestyle dramatically. With the MS drug likely to come in the next year, I would hope. The same kind of results could occur for MS patients with severe problems of spasticity, which affects sleep, pain, your bowels, and overall life quality very dramatically. So as the members of this great committee are asked, why you serve in the House, this is a real good example of the legacy you create when you update the law with progress in science that's proven out and approved by the agency at the federal level. Then we move product to people who need it quickly, and that makes a tremendous difference. And we thank you for it.
Thank you. Had a motion and a second.
If I could just allow Mr. Smith a few minutes,
Okay.
From the Hemp Farmers Association.
Sure.
Thank you.
Thank you so much, Madam Chair Lady. I appreciate the opportunity to represent the hardest working members of society, I think, the American farmer. And one of the things that I'd like to point out with what we do as hemp farmers is we grow multiple cannabinoids, lots and lots of different cannabinoids that are associated to our hemp plant. Two most noted is THC and CBD, but there are CBN, CBG, there's a whole lot of other cannabinoids. And I appreciate and applaud Chair Lady Moser for taking the time to learn and understand the language between cannabidiol and cannabinoids and the inclusiveness of more of the aspects of our crop being researched and hopefully get out to an open market. And that's where we farmers are most interested in moving forward, is new markets. And I appreciate and applaud stepping ahead and starting to let the groundwork happen for FDA approval of these cannabinoids that we produce. And hopefully we will, again, like Bob and Rebecca said, help the folks in most need. Thank you for the opportunity to speak today.
Thank you so much. I really appreciate your input. I know how what a difference this is going to make to the hemp farmers across Kentucky. All members should have a letter from the Kentucky Cannabis Association, I believe, in your packets, just discussing the benefits of expanding research in this area. I will say that 4 years ago, I couldn't even pronounce cannabidiol or cannabinoid. I did not really know what they were. Thanks to Martin and thanks to Bob and his team and so many others, I've learned a lot. I think there are definitely benefits, and this one small word change is going to make a huge difference. This measure is also supported by the Department of Agriculture and Commissioner Quarles. So, thank you.
We have one question or comment, Representative Bentley.
Thank you, Lady Chairman. I have a comment. When I first came to Frankfurt on the first week, someone handed me a bill, and it was written against the opioid situation, but they didn't know the difference between opiate and opioids. Words matter. And so just like this would extend some research. We know that there's some research being done at Yale, even though it's still Schedule 1 on marijuana. It's been approved by the DEA. And we see this as an opportunity for more industry, agricultural industry in Kentucky. I am not against safety and efficacy of a product. Just like Representative Moser, I'll give you a pay grade increase. We've always talked about this. We're not against it. We're for safety, and I've said it a million times. The first section of the Kentucky Constitution we take an oath to has the word safety in it. And if you do safety and efficacy, you come back with this, and you're going to increase your business. And I'm just glad to hear that, So everybody knows me. If it's safety and efficacy, I'll vote yes on it. If it's not, I'll vote no on it. Thank you. Thank you, Lady Chairman.
Thank you. We've had a first and a second. Madam Secretary, take the roll.
Representative Bentley?
Yes.
Representative Bowling? Yes. Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier,
Yes.
Representative Marzian, Representative Prunty,
Yes.
Representative Rayburn,
Yes.
Representative Raymond, Representative Riley,
As a parent of a son who is prescribed Epidiolex, I vote yes.
Representative Sharp,
Yes.
Representative Sheldon, Representative Tate, Representative Weber,
Yes.
Representative Westrom,
That I'm grateful that we are on the cutting edge along with our farmers. This is wonderful. Thank you, and yes.
Representative Wilner,
Yes.
Chairwoman Mosier.
Yes.
House Bill 307 passes with favorable expression and should do so on the House floor. I just want to say that I have been lobbied by our oldest daughter. She's a good friend of Adrian Polniak for several years. I've been over to Midway, close to where their office is, and so thank you again for bringing such a good piece of legislation.
Thank you.
Is there anyone else that would like to record a vote on any other bills? Representative Bray?
Yes, I'd like to record a yes vote on House Bill 219.
Anybody else? Motion for adjournment? Second?
Thank you all.
We're adjourned.
Hey, you. That's great. That's fine. Wonderful. No, I think they get it. I think the fundamentals come across, and they, we don't get the crazy, is this medical marijuana or what the hell are you doing or all that kind of thing. Yeah, I thought we captured it well, and Martin was very reasonable. So what a day! What a freaking day! You've gone from chemical manufacturing to athletic training to pharmacological advancement, and we're not finished yet. The what? Oh yeah, is that 1:30?